Intermittent fasting is a dietary approach that involves restricting your calorie intake to specific windows of time, typically ranging from 16 to 24 hours per day. Studies have linked intermittent fasting to a number of health benefits, including weight loss, decreased risk factors of heart disease, lower blood pressure, improved insulin sensitivity, reduction in markers of oxidative stress, improved blood sugar control. These findings have led to the increased popularity of intermittent fasting regimens like time-restricted feeding. This involves limiting your eating window to a certain number of hours each day. For example, you might eat all of your meals within an 8-hour window and then fast for the remaining 16 hours of the day. Alternate day fasting. This involves alternating between days of normal eating and days where you consume very few calories, typically around 500 to 600 calories. Periodic fasting. This involves eating normally for 5 days of the week and then restricting calorie intake to around 500 to 600 calories for the remaining 2 days. If you're interested in trying out intermittent fasting, you're probably curious to know whether it has side effects. Here are some common side effects of intermittent fasting. Hunger and cravings. The effects of intermittent fasting on hunger and cravings can vary depending on several factors, including the individual's eating habits, the type of intermittent fasting protocol they follow, and their overall health. Some people report increased hunger and cravings during the initial stages of intermittent fasting as their body adjusts to the new eating pattern. However, many people find that their hunger and cravings decrease over time as their body adapts to the new eating schedule. Studies have shown that intermittent fasting can lead to changes in hormone levels that affect hunger and appetite. For example, during the fasting period, the body increases production of the hormone ghrelin, which stimulates hunger. However, over time, the body may become less sensitive to ghrelin, which can lead to a reduction in hunger. In terms of cravings, some people may experience more intense cravings during the initial stages of intermittent fasting, especially if they are used to consuming high amounts of sugar or processed foods. However, as they adapt to the new eating pattern and consume more nutrient-dense foods during their eating periods, their cravings may decrease. Overall, the effects of intermittent fasting on hunger and cravings can vary from person to person. It is important to listen to your body and adjust your intermittent fasting protocol as needed to ensure that you are meeting your nutritional needs and feeling satisfied with your food intake. Headaches and lightheadedness. Headaches and lightheadedness are common side effects that some people may experience when starting an intermittent fasting regimen. These symptoms can occur for several reasons, including changes in blood sugar levels, dehydration, and caffeine withdrawal. When an individual is fasting, their body is not receiving a constant supply of glucose, sugar, from food. As a result, blood sugar levels may drop, leading to symptoms such as headaches and lightheadedness. It is important to make sure you are consuming enough calories and staying hydrated during your eating periods to avoid these symptoms. Dehydration can also cause headaches and lightheadedness. When you are not eating, it is easy to forget to drink enough water. Make sure to drink plenty of fluids during your eating periods to stay hydrated and prevent these symptoms. If you experience persistent headaches or lightheadedness while doing intermittent fasting, it is important to speak with a healthcare professional to rule out any underlying medical conditions. Additionally, it may be helpful to adjust your intermittent fasting protocol or seek guidance from a registered dietitian to ensure that you are meeting your nutritional needs while fasting. Fatigue and low energy. People may experience fatigue and low energy during the initial stages of intermittent fasting. This is because your body is adjusting to a new eating schedule and is not used to going for extended periods without food. During the fasting period, your body's glycogen stores are depleted, which can cause a drop in blood sugar levels. This drop in blood sugar levels can cause feelings of fatigue, weakness, and low energy levels. Additionally, fasting can also cause changes in your body's hormone levels, such as an increase in cortisol, which can lead to feelings of stress and fatigue. To reduce the impact of fatigue and low energy levels during intermittent fasting, it's important to make sure that you are consuming enough calories and nutrients during your eating window. Eating a balanced diet with plenty of protein, healthy fats, and complex carbohydrates can help you feel more energized and reduce feelings of fatigue. It's also important to stay hydrated during the fasting period by drinking plenty of water and avoiding caffeinated drinks, which can contribute to dehydration and feelings of fatigue. Dehydration can be a potential side effect of intermittent fasting, particularly if you are not drinking enough fluids during the fasting period. When you are fasting, you are not getting fluids from food, which means that you need to drink more water than usual to prevent dehydration. Dehydration can cause a number of unpleasant symptoms, including headaches, dizziness, and fatigue. To prevent dehydration during intermittent fasting, it's important to drink plenty of water throughout the day, especially during the eating window. Drinking other fluids like herbal teas, bone broth, and electrolyte drinks can also help replenish fluids and electrolytes lost during the fasting period. It's also important to avoid or limit diuretic beverages like coffee and alcohol, which can contribute to dehydration. If you experience symptoms of dehydration during intermittent fasting, such as dark urine, dry mouth, or thirst, it's important to drink fluids immediately to prevent further dehydration. Digestive issues. Here are some common digestive issues that people may experience while doing intermittent fasting. Acid reflux. Fasting can lead to an increase in stomach acid production, which can cause acid reflux and heartburn. Constipation. Some people may experience constipation during the fasting period due to a lack of fiber in their diet. Diarrhea. In some cases, fasting can cause diarrhea due to changes in the gut microbiome. Nausea. Nausea can be a common side effect during the initial stages of intermittent fasting as your body adjusts to the new eating schedule. Stomach cramps. Some people may experience stomach cramps during the fasting period, especially if they have a history of digestive issues. To reduce the impact of digestive issues during intermittent fasting, it's important to make sure that you are consuming enough fiber and other nutrients during the eating window. Eating a balanced diet with plenty of fruits, vegetables, and whole grains can help prevent constipation and other digestive issues. It's also important to avoid overeating or consuming large meals during the eating window, as this can put additional stress on the digestive system. Drinking plenty of water and other fluids can also help prevent digestive issues by keeping the digestive tract hydrated. Sleep disturbances can be a potential side effect of intermittent fasting, particularly if you are not getting enough nutrients or if your body is not adjusting well to the new eating schedule. Here are some ways that intermittent fasting can affect your sleep. Hunger and cravings. Hunger and food cravings can make it difficult to fall asleep or stay asleep during the fasting period. Increased cortisol levels. Fasting can cause an increase in cortisol, which can disrupt the body's natural sleep-wake cycle and lead to insomnia. Blood sugar imbalances. Fasting can cause fluctuations in blood sugar levels, which can disrupt sleep and cause feelings of fatigue during the day. Dehydration. As mentioned earlier, fasting can cause dehydration, which can also contribute to sleep disturbances. To reduce the impact of sleep disturbances during intermittent fasting, it's important to make sure that you are getting enough nutrients and calories during the eating window. Eating a balanced diet with plenty of protein, healthy fats, and complex carbohydrates can help you feel more satiated and reduce hunger and food cravings. It's also important to stay hydrated during the fasting period by drinking plenty of water and other fluids, as dehydration can contribute to sleep disturbances. Practicing good sleep hygiene, such as establishing a regular sleep schedule and avoiding stimulating activities before bed, can also help improve the quality of your sleep. Who should avoid intermittent fasting? Although intermittent fasting may be a smart choice for some people, it's not appropriate or safe for others. Some people may be at risk of dangerous side effects if they participate in intermittent fasting. Healthcare professionals generally advise to avoid intermittent fasting to people who are pregnant or breastfeeding mother, young children, teens, older adults who experience weakness, people with immunodeficiencies, people with current or past eating disorders. It is always important to consult doctors before you start doing intermittent fasting. Stay safe and stay healthy. Thanks for watching.